are specially designed to permit free movement. Joints or articulations may be classified on a functional basis as being immovable, slightly movable, or freely movable. They may also be classified on a morphological basis depending upon their structure. For the purposes of this videotape, a morphological classification will be used, although the degree of movement permitted by the various types of joints will be discussed. The simplest joints are the fibrous joints, in which the bones are held together by fibrous connective tissue. An example is the joint between adjacent flat bones of the skull. This joint is called a synarthrosis, or suture joint. Here, the contiguous ends of the bones are jagged and fit together. In life, they are firmly held in place by a small amount of fibrous connective tissue, and minimal movement occurs between the bones. Gymphosis means bolting together, and this type of joint is seen in the dentition. Here, the tooth as a peg fits into a hole in the alveolar bone of the jaw and is firmly held in place by the fibrous periodontal membrane. Syndesmosis means joining by a band, and in this type of fibrous joint, some movement is permitted. In the forearm, the radius and ulna are connected by this band of connective tissue called an interosseous membrane, which permits a limited amount of movement between the bones. Similarly, a tibio-fibula syndesmosis is present at the distal ends of these bones of the lower limb. The second category of joints are the cartilaginous joints, in which the articulating ends of the bones are connected by cartilage. Usually, this type of joint permits a slight degree of movement. The joint between the bodies of the pubic bones shown here is called a symphysis. In this type of cartilaginous joint, the articulating ends of the bones are covered by hyaline cartilage and are united by a flattened disc of fibrocartilage. This type of joint is usually reinforced by ligaments that pass from one bone to the other, and only a limited amount of movement is permitted. Symphyses are also present in the vertebral column, where the bodies of two adjacent vertebrae are joined together by a fibrocartilaginous intervertebral disc. The joint is also reinforced by ligamentous fibers. A synchondrosis is a special type of cartilaginous joint which permits no movement between two bones that are united by hyaline cartilage. A good example is the joint between the first rib and the manubrium sterni. These bones are firmly joined by the first costal cartilage, which is hyaline cartilage. Synchondroses are also found in developing long bones and are referred to as primary cartilaginous joints. In this radiogram of the ulna of a young girl, the ossified end of the bone is joined to the shaft by a cartilaginous epiphyseal plate. This union is a synchondrosis. It must be noted that the epiphyseal plate is the area where bone growth occurs, and it becomes ossified when development of the skeleton is complete. The final category of joints found in the skeleton is the synovial joint. These joints permit free movement between the bones and are characterized structurally by the presence of a joint cavity. The following diagrammatic representation of a synovial joint will help to explain its basic structure. The ends of the articulating bones are covered by hyaline cartilage and are closely opposed to each other. They are held in this position by an encircling sleeve of connective tissue known as the joint capsule. This capsule is lined by the thin synovial membrane, which also covers the ends of the bones, but does not extend over the articular cartilages. The joint cavity is filled with synovial fluid, which originates from the synovial membrane. This synovial fluid plays a role in the nourishment of the avascular articular cartilage and is also believed to act as a lubricant during movement at the joint. Although synovial joints are freely movable, the actual range of movement permitted is dependent on the shape of the articular surfaces of the bones, the strength and tautness of the joint capsule and associated ligaments, and on the size, arrangement, and action of the muscles acting on the joint. Let us now look at some of the various types of synovial joints. A particular type of synovial joint in which there is no angular movement between the bones is called a plane joint. In this type of joint, only a restricted amount of gliding movement is permitted between two almost flat articular surfaces. The joints between the carpal bones are representative of this type of joint. Movement between the bones is restricted by the presence of tight joint capsules and strong ligaments. Hinge joints permit movement around a transverse axis. In the elbow joint shown here, the ends of the articulating bones are adapted to each other so that the trochlea and capitulum of the humerus articulates with the trochlear notch of the ulna and the head of the radius, respectively. Strong collateral ligaments connecting the bones help to support the joint. This joint acts as a hinge during flexion and extension of the arm. The interphalangeal joints of the fingers and toes are also hinge joints. The condylar joint represents a variation of the hinge joint. In this type of joint, two distinct pairs of articular surfaces called condyles move in relation to each other. To permit a hinge movement as the principal action, in the knee joint shown here, the medial and the lateral condyles of the femur articulate with the medial and lateral condyles of the tibia. The principal movements permitted at this joint are flexion and extension. It should be pointed out that the knee joint is a very complex joint and that axial rotation of the femur occurs during flexion and extension at this joint. The knee joint and its actions will be described in detail in the subsequent videotape. Pivot joints are those in which rotation occurs around a longitudinal axis. The joint between the first and second cervical vertebrae is an example of a pivot joint. Here, the skull sits on the atlas, which forms a ring around the upward projecting dens of the axis. When the head is rotated, the axis pivots around the dens. Another type of pivot joint is found in the proximal radio-ulnar joint. During pronation and supination of the hand, the head of the radius rotates within a ring formed by the radial notch of the ulna and the annular ligament. Most of the synovial joints described thus far permitted movement principally around one axis, although, as mentioned, accessory movements occur in some cases. Other synovial joints permit movement around two axes and may be described as biaxial joints. Examples of two types will be described. In the ellipsoid joint, a concavity on one bone articulates with the convex surface of another. In the metacarpal phalangeal joint shown here, the shallow concavity of the proximal phalanx fits over the convex head of the metacarpal bone. Flexion, extension, abduction, and adduction are the movements permitted at this joint. The combined action of these four movements performed in sequence is called circumduction. Similar movements are possible at the wrist joint. The wrist joint presents a more complex arrangement. Here, the lower end of the radius plus a fibrocartilaginous articular disc that joins the ends of the radius and ulna form the concave surface that articulates with the convex surface of the scaphoid, lunate, and triquetral bones. Another type of joint in which the bones meet each other in a concavo-convex relationship is the saddle joint, between the metacarpal of the thumb and the trapezium. The primary movements permitted include flexion, extension, abduction, adduction, and circumduction. In addition, accessory movements are permitted, but these may be better appreciated during a detailed study of the joints of the upper limb. The ball and socket joints permit the widest range of movement. This joint, in which the head of the humerus articulates with the glenoid fossa of the scapula, permits movement in all directions, including rotation of the humerus along its long axis. The hip joint is also a ball and socket joint, but it is more adapted for stability. The range of movement permitted is restricted by the shape of the articular surfaces and the placement of the muscles and ligaments associated with the joint. Some synovial joints may be modified by the presence of a fibrocartilaginous disc between the two articulating bones. In this diagram of the temporomandibular joint, the head of the mandible articulates with the mandibular fossa of the temporal bone. Interposed between them is a fibrocartilaginous disc, which is attached around its periphery to the joint capsule. The joint cavity is thus divided into an upper and a lower compartment. During speaking, when the mouth is slightly opened and closed, a hinge action occurs utilizing the lower compartment. When the mouth is opened wide, as in yawning, then the upper compartment comes into play. The fibrocartilaginous disc slides forward, carrying the head of the mandible with it. Articular discs are also found in the knee joint, where they are referred to as menisci. In summary, articulations or joints may be classified on a morphological basis as being one of fibrous, cartilaginous, or synovial. Fibrous and cartilaginous joints permit either a slight degree of movement or no movement at all, depending upon the structure of the particular joint. On the other hand, synovial joints are usually freely movable. The synarthrosis or suture joint, the gumphosis, and the syndesmosis are types of fibrous joints. The types of cartilaginous joints discussed were the symphysis and the synchondrosis. The widest variety of joints is found among the synovial type. These include the plane joint, the hinge joint, the condylar joint, the pivot joint, the ellipsoid joint, the saddle joint, and the ball and socket joint.